everyone, and thank you for joining us today. Welcome to the American Medical Association's Private Practice Simple Solutions, part of the Steps Forward Innovation Academy. Before we get started with the content, a quick few housekeeping items. The Private Practice Simple Solutions program is a series of rapid learning cycles designed to provide opportunities to implement actionable changes that can immediately increase efficiency. Please note that this presentation has been recorded and is for informational purposes only. You should consult a professional advisor for specific medical, legal, financial, or other advice. Please take a moment to carefully review this notice. And now I'd like to introduce today's speakers. Megan Nolan should be joining us shortly, but she's also on here and a co-founder for Mikata Health. Dr. Nikki Panich, a family medicine and maternal care at a clinic in Canada. She's using the Mikata Health stuff that we'll be talking about today and asking questions. And Dr. Si Chen, who's moderating our discussion today. Go ahead and take it away.
Well, I'd like to thank our viewers today for joining in, and thank you, Dr. Panich, for being here today with us. I know we gave a tiny introduction for you, but could you sort of introduce yourself, tell us a little bit more about your practice before we get started with questions?
Yeah, no, absolutely my pleasure. And thank you for having me today. So I'm Nikki Panich. I'm a family physician with a practice that focuses a lot on maternal and newborn care. I do obstetrics. And so a lot of the innovation that you'll hear about is specifically for my pregnancy population.
That's great. I know you and Megan last webinar that we had gave a great overview, basically defining patient engagement as supporting and facilitating patients to be actively involved in their own care through access, communication, and empowerment. I think these are very, very powerful tools to help patients and physicians deliver better care, because the more engaged a patient is, I think the more compliant they'll be with their own care, and the more really motivated to take care of themselves and their health and their well-being. So I think this is a really important topic. And so I'd like to start diving into some questions that I have for you. Once Megan sort of joins, I can ask her some questions on the technology side as well. So in terms of last webinar, you discussed a couple of features that that were in the patient engagement technology that you had: SMS messaging, instructions and forms, and distress screening. In terms of your practices, your patient satisfaction, what has been the most helpful, do you think, of those or any other features that you've talked about?
Yeah, well, I mean, we really got started with our journey during COVID. And, I think that's one of the blessings that came out of COVID was it kind of pushed us a little bit into the 21st century as healthcare providers. And so we started with reminder systems for appointments, but also letting people know when it was safe to come into the clinic. When we were doing social distancing, people would stay in their cars until they could be brought into a room. And so that was how we got started. And then we progressed into using messaging, not only to give information about different weeks of the pregnancy or investigations that might be coming or some of the common things that people could expect, but also in depression screening. And one of the reasons that is really meaningful to my practice is that if somebody screens high, we know to book a little bit extra time during that visit so that we can delve in a little deeper. I think from a patient perspective that they would tell you that their favorite part of it is the information that they're getting and that ability to, to submit questions in advance or to learn about some of the common things, because then we spend our appointment time talking about what's most important to them and not necessarily on the routine education of, what's a groupie strap swab or why am I doing a sugar test in pregnancy and some of those more routine things that everybody does.
That's great. That information, I think, is a really, really important piece of things. A lot of the times, especially when patients maybe not have, English as a first language, it's very difficult for them to understand what we're talking about, especially when it comes to written, all the medical jargon that we use. So I know you mentioned in the last webinar that you had a lot of patients that didn't have English as a first language, Spanish, obviously, but maybe Punjabi, Hindi. What's the most unusual language that you've had to deal with? And was that patient engagement software able to handle that at that point in time? Like for instance, I had a Tibetan speaker in my clinic, and it was very difficult to figure that out.
Yeah, for written materials, the most difficult language I've come across is Pashto. And it's difficult to find written medical translators. I'm able to find verbal translators and get real-time translation, but written is a little more difficult, and for a couple of reasons. One, you want medical language, but also medical language at an appropriate level. So not only Pashto, but grade 5 Pashto with medical language. One of the interesting things that I've learned with working with such a diverse population is that people that have very good spoken English, in many cases still prefer a translator for medical terms because they want to use the words that they're familiar with or the words that they grew up with. And sometimes I'm surprised at the patients that request translation. And so the ability to be able to give that routine education in the most common languages that our patient population speak is really meaningful, especially when you're doing something subtle like screening for depression and you're trying to get at the nuance of particular behaviors. So that's where we find it very impactful and very helpful to be able to use our translated services.
That's great. I think that's really, really an important aspect of patient engagement is to meet the patient where they are. And language, I think, is one of the biggest factors in all of that. So that's great that you're able to offer that service to your patients. In terms of, switching gears a little bit,
Sure.
what are these, what are these features that you've seen that have actually given the highest sort of return on investment monetarily in your practice? If you can think of one off the top of your head, for instance.
Yeah, I would say from a practice perspective, it's probably the appointment reminders. So being a specialty practice that accepts referrals, having that reminder for people of when their appointment is, but also the instructions of how to get there. And so we not only include driving instructions, but also the easiest ways to get to us with public transportation, because that can be very meaningful for people. And so, anytime that a spot is not used, that's lost revenue. And so, and again, having people be able to translate those instructions into their language of choice is very meaningful as well.
Yeah, I bet I remember you were saying in the last webinar that you had cut your no-show rates by a significant amount. So that's obviously impactful to the bottom line for sure.
And that's helpful for the entire population. One of the problems as a community that we tackled about 10 years ago was a subpopulation of women that were showing up to labor and delivery with no prenatal care. And so we did a very concerted effort to figure out, the different ways that we could partner with walk-in clinics and other community practices that were servicing unattached patients to try and really get them into a prenatal care provider, be it high risk, low risk, midwife, whatever the patient wanted. But it was a very targeted initiative. And so, those spots, new patient spots are very valuable, and we want to make sure that they're being used by people that need them.
Right. Absolutely. Free up those slots for quicker access for higher acuity patients as well. That's super impactful, I think. In terms of, ramping up using this technology platform, how long did it take you to do, maybe not to iron out all the kinks, but just really start using the platform?
Yeah, it was a bigger lift for my front office staff and team than me. I mean, my work was more around helping craft the different messages that we were sending at different points in pregnancy, figuring out when we wanted to do a routine depression screening and how we were going to alter our appointments and according to that. But the platform itself is actually very intuitive. And so once, and the Mekata team was wonderful. They came on site, they looked at how our reception team was working and how, their technology could embed in the existing workflows. I would say one of the biggest learnings for me going through this process is the person that owns that task and the person that owns that job is the best person to tell you, how to bring this into their day, and certainly empowering them with the ownership and championing of that was part of the success in the change management. COVID made things a necessity. We wanted to be safe, and excuse me, knowing that pregnant women were at increased risk of infection just given the immunocompromised state. Necessity is the mother of invention, and so we actually probably implemented faster than what would have been the case had we not have been in a pandemic. So I think we onboarded, fully within a few weeks. Like, it was very quick. And we did have wonderful support from the Mekata team on site to help us with the technical implementation pieces.
Yeah, I'm glad you mentioned, workflow and ownership from your staff. Did you, obviously, COVID really facilitated things quickly because of necessity, but in some of these other pieces that weren't so urgent, did you come up with a sort of a framework to get a team around adoption? And so how did you go about doing that?
Yeah, so a very multidisciplinary team. So the person that was championing from the reception team, our lead nurse, in terms of messaging, office manager, in terms of how we were prioritizing different languages, and then myself as the physician champion. I'm always the one that seems to be pushing my my physician colleagues along the spectrum of technology and adoption. I tend to be the early adopter in our practice of these sorts of things.
Gotcha. Speaking of which, as an early adopter, what's the biggest hurdle that you faced, adopting these technologies and actually doing patient engagement through technology?
Yeah, I would say one of the things that took a little bit of learning at first is that the Mekata platform is EMR agnostic, but it doesn't sit within the EMR. So it works with it, but not directly, it's not a button within the EMR functionality, or certainly wasn't when we started. And so just figuring out how to balance, when our team was looking at, the messaging screen and how things were going out, eventually we set up a bunch of automations so that with specific appointment reminders, the messaging went automatically. So there wasn't rework, but just figuring out that, how to tie things together and really how to make it part of existing workflows. That took a little bit of time and a little bit of practice, which again is part of the change management. And as I said, COVID was a reason for all sorts of things to change. So the timing of it was actually very welcome from the staff.
Gotcha. Well, I see Megan's joined us. Welcome, Megan. Thanks for joining us today.
Thank you. My apologies for being late today. I'm sorry.
Oh, no worries. No worries. Dr. Paniccia and I have been having a good conversation so far, and hopefully we can jump in with you soon as well. But I want to pause here first just to tell our viewers and audience members, please, if you have questions, don't hesitate to put them into the Q&A box that Sumbul pointed out earlier, so that we can have a more robust discussion. But we can certainly keep on talking. I can certainly keep on talking on these subjects. They're very, very important, and I think would benefit all of our patients. So Megan, if you don't mind, we had a small introduction from Sumbul at the top of the presentation, but if you don't mind just introducing yourself again to our listeners with your background.
Absolutely. My name is Megan Nolan. I'm the co-founder of Mekata Health. We're a health tech company based out of Canada. And really the mission at Mekata is to take care of anything and everything that gets in the way of patient care. So with that, we've built a platform that can automate a lot of different workflows and tasks for both the teams who work at clinics as well as the providers themselves. My background is in the field of user experience design. So I love understanding people's goals, how they work, and then designing digital products that can hopefully make that easier and more enjoyable for them.
Great. Thanks for joining us. I think you have from the technology side of things and user experience side of things, I think you bring a very, very important voice to this discussion today. So right off the bat, I'm going to ask you, in dealing with a lot of physician practices, what are the features that folks tend to ask for most often?
Yeah, I think some of the features, or I think things that really make technology work for practitioners is number one, it has to be easy to use. I think that, sometimes more kind of traditional or previously, that wasn't maybe a number one kind of factor for software, but I think more and more people are realizing that it really has to be intuitive and easy to use. Not something that you need a big, thick manual or days and days of training to wrap your head around. And that really goes for both patients and for the healthcare teams themselves. And so one of the reasons this is really important is that when a system is easy to use, that means that patients can actually engage with it and they will use it. And when they do use the technology, it lives up to the promise of benefits that the team is really looking for. So for example, if you're sending out something as simple as appointment reminders and maybe forms that you want patients to complete ahead of time, or if you want them to use an online booking tool, if it's very easy for the patient to use, they're actually going to engage with that. And if they actually engage with it, you're actually going to reduce the workloads on yourself and your team. So I think that's like really key, is that ease of use. And then another thing that we really see is customizability. I would say, again, is another, not necessarily like a specific tool or feature, but kind of a quality of really successful tools. Because I think working with many clinics, it can be even from small to large practices, there's little nuances with each provider's workflow. And so when you have a really customizable system, you're able to actually accommodate for all of those nuances and differences and get something that can actually fit your clinic's needs. So I think that ease of use, that customizability are just really key. I would call them features of software. So whether you're interested in online booking and AI scribe, reminders, forms, it can be any or all of those, but kind of those qualities are really key.
Yeah, I think we'll be talking about this in a little bit, but it goes well with your spicy checklist. So I really love that acronym. So we'll dive into that in just a second. But in working with a lot of these physician practices, how long would you say the range is in timeframes of the ramp up times for these practices for adopting your particular software and then software in general for patient engagement?
Yeah, well, I think it can vary, and I think some of the most successful kind of approach, one of the most successful ways to approach it, I think, is always trying to find a quick win and kind of starting small and building. Because I think if you try to do all of it all at once, it's very overwhelming, and you can kind of lose that momentum. So I think it's most successful when clinics, they choose something and just kind of start small. So for example, with our secure direct messaging with patients, we can get that up and running in a single afternoon. Similarly with our AI scribe tools, those things are very easy for people to get started, just in a few minutes even. With things like reminders, where we're customizing when patients will get messages, what they'll get, the forms that go along with that can take a couple weeks. And then something like online booking would also be similar to that. So yeah, the way that we work with clinics is we actually have an onboarding team who they're the experts in the software, and they work with the clinic to understand what they're trying to accomplish, what those nuances are in their workflow, and then they kind of configure it for the provider. So that's one way to also kind of smooth out that onboarding process and minimize the time frame. Other solutions have a more DIY approach, and that can also work well. But either way, I think trying to find something bite size and then having that quick win where, you know, you send out that first set of notifications and you see patients confirming or completing things, and you get that see that benefit right away. I think then you're like, okay, what else can we do? What else can we do?
Yeah, it's that dopamine hit that you get from your first sort of
Exactly.
Right. I think that that's really key. I'm always telling my team I want some quick wins so that we can get the momentum going. Exactly. And so Dr. Panich, Megan just sort of mentioned the SMS messaging just takes, you know, on a software platform, half a day to get up and running in afternoon. Knowing that that needs to integrate in your workflow, how long did it take you to sort of work out the details of the workflow to get that really, really humming in your clinic?
Yeah, I think it took a few weeks. You know, you try one thing, and as I said, the Mekata platform is EMR agnostic, but figuring out how to, you know, work that into the check-in process, or if somebody didn't show, you know, how you were going to follow up, or, you know, how many reminders you were going to send for a new patient visit and the timing of that. And so there was a little bit of experimentation to try and optimize things. And that's just normal. It's almost, you know, like A/B testing, try this, try that, see what your, you know, success rate is better at getting confirmations, et cetera, et cetera. And so, yeah, a few weeks for sure. I would say things were fully ironed out, probably within a few months, but you know, where we kind of knew the easy path. But it was not, the technology itself wasn't the difficult piece of the implementation. It's the change management that goes along with it, and the integrating into workflows and kind of breaking habits. I think, what does the literature say? It takes about 3 weeks to set a new habit. That's probably in line with, you know, with what it took to really make it feel normal and part of the workday.
Right. I mean, if we have a story about this, you know, everybody knows that when EHRs came around, I guess some folks don't. I'm old enough to know when we were still paper, but
me too.
When that came around, you know, it took, you know, a couple of weeks to launch maybe, but at this point, have we even, is it ironed out yet, you know, with all our workflows? For some clinics it is, for others it's not. And so even though rolling out a software platform may be quick, we all need to sort of really dig into those workflows to get it up and running and humming in our clinics.
Well, and that's where engaging the people who really, you know, it's their role is so powerful, because they're going to tell you much better than I'm going to guess how to implement this into their day and how to optimize things. And so, as I said before, that was one of the really big team learnings from this.
Megan, you know, switching gears a little bit, like looking towards the future, what do you think the next area in patient engagement that's ripe for innovation at this point?
That's a great question. I really think it's been really exciting to see the role that generative AI can play. And so I think there's roles for both kind of traditional and this newer kind of style of artificial intelligence with these large language models. And I think where that can come into play is twofold. Like, we're seeing some really exciting results just in terms of using generative AI to help cut down on the amount of charting and documentation that providers have to do. So something that, for example, that I think really benefits both the providers and their patients is that, you know, we can capture the audio from that patient encounter and not only help the physician generate their note, but we can also use the AI to generate a patient-friendly summary. So taking that conversation and summarizing what was discussed and what the next steps are, you know, at a 6th grade reading level for someone with no medical training, and then using our messaging tools to put that in the patient's hands so that they can actually take that information away with them. You know, I think there's, it's like 50 to 80% of what's discussed in a visit is often forgotten by the patient by the time they walk out the door. And so being able to give them that information, their next steps, and then using these tools to kind of help them complete those next steps on the patient journey. So, if it's follow up with me in 2 weeks, okay, well, can we automatically follow up with that patient and prompt them to book that appointment? So what I see kind of on the horizon is, we've had some automation where, we're sending out, okay, we're able to send out all of these different kind of notifications before and after appointments. And so far we've been doing it in a bit of a like set it and forget it kind of way, setting up different sequences for different kinds of patients and appointments. But what I see kind of coming over the horizon with AI is this ability to really be much more dynamic and personalized to the patient with that, and really helping them along in their journey. So kind of being an assistant for the providers and teams, but also an assistant for the patient as they navigate each of the steps that they have to take when it comes to their care. So I'm really excited to see what that can look like.
Yeah, I think AI is this wonderful and scary thing that we all have to sort of digest on the horizon. But I think if we can really, really follow and leverage all the benefits that AI has to offer, I think it'll make a lot of our lives easier, hopefully in the future. But of course, we have to have some guardrails in place so that we don't mess it up. So
absolutely. I find it's really, where it can be most powerful is taking care of the more tedious aspects. Like for example, when I have meetings and calls now, I use an AI note taker. And so I'm still running the meeting. I'm still, kind of deciding what's going to happen or what the next steps are going to be. But then that AI is coming in and capturing that and like writing a really good note. And that's the part that I don't get to, that if I did that, it would be really helpful to the rest of my team. And so with AI, I feel like, it's helping me kind of fill in those like blanks that often get left to the side because you just don't have enough time to do everything. So yeah, it's going to be interesting to see how it develops, but I think there's a lot of potential.
I think on the same lines, Dr. Panich, what in your clinic do you think that you want to do next in the field of patient engagement, whether it be AI tools versus something even non-technology based?
Yeah, it's interesting. So one of the things that actually we've been working in a pilot phase with the Mekata team is transferring of patient information, and how, when you're referring somebody from provider to provider, how do you make sure that the right things are going to the right places at the right time? And although it's not a direct patient engagement tool, it really does impact their care journey. And so, it's thinking about automation, and it's thinking about information transfer, and the patient not having to retell their story. So, I mean, I guess that is a form of patient engagement and or patient experience that we're impacting. And so it's really about getting the right information to the right person at the right time. And if, an investigation is ordered but pending, how does that get attached and, sent to the right person when it's done? And just some of that administrative work that can delay care and that can make the patient, have to say, oh, no, I did have that, and somebody run out and grab it. And so it's really about, organizing information and having it ready for somebody to act on when a patient is sitting in front of them. So it's about the broader patient care journey and patient experience.
Absolutely. I think patients oftentimes will get frustrated if we refer patients out to other providers and then, that information isn't there and the provider comes in and has not a clue as to what is going on. So I think that is a very area that can get ironed out for patient satisfaction as well. So, and confidence, quite honestly, in their providing care teams. So I think, we're going to try to sum this up because we're getting close to time, but I did want to get to that spicy checklist because I think now moving towards, how folks that are on the call may want to adopt some of these technologies for patient engagement in the future. How do you start? And so you laid out beautifully, this checklist. what I want, all of these things are important. All of these points are important, from the supported, private, and secure, integrated, customizable, expandable, and engaging. All of them are important, but how would you go about prioritizing, these points, or this checklist? What's the most important thing that you need to look at? And I'll throw this to Dr. Panich first, and then I'll have Megan comment.
For me, I think the two, so if you're vetting a technology, you have to make sure that it's private and secure. So for me, that's kind of table stakes. The two most important are integrated. So buy-in from the team, because that's going to be such a big part of the change management piece, and also customizable in that you can adapt it to your workflow, and not necessarily have to change your workflow to bring in the technology. And if that's not the best, if your workflow is working and it's, and you can add it on, sometimes you have to change how you do things. But most of the time, if you can integrate and tie things to work that you're already doing, then it's going to be way easier to adopt. So yeah, so from my perspective, those are the two key.
Great. And Megan, what are your thoughts?
Yeah, I think fairly similar to Dr. Panich. I would say one of the things that one of the reasons that we match customers with an onboarding team and try to provide that really supported experience is to try and get the help with the change management. Because I think, as Dr. Panich pointed out earlier in the presentation, it's not necessarily the technology, but it is really that team experience of change. And so I think that, whether it's a DIY approach or a more, let's say, white glove approach, understanding what that needs to look like for your team, and then making sure that you partner with a vendor that is able to provide that kind of experience. I think it is important, because I think, getting to that light bulb moment where you have that quick win, it really is powerful for teams. I think going through change management, I guess I think that is probably one of the biggest takeaways is, how can you, if you're going to, start doing something around patient engagement or do more, how do you approach that so that you get that quick win for your team and that part of the experience? So I would say the supported piece, and then just echoing Dr. Panich's comment, I think the customizability really is key to, like Dr. Panich is saying, not having teams have to throw out or change, so much the way that they're doing things, but really trying to come in alongside that and enhance the things that are working, but also take away the things that are pain points.
And really, celebrating the simple things. The first time somebody confirms yes to an appointment, that's a moment to celebrate. When you get 10, confirmations in a day, that's a reason to celebrate. And just, taking the time to do that, I think, is really important. And A, it builds momentum for the team, but B, it acknowledges the hard work that's gone up to get to that point. And, and that's important to keep motivating people to continue to want to iterate and change and, adopt the next thing. Because there's always something new as an early adopter.
Yeah.
That's right. And as an early adopter, what pearls of wisdom would you give our audience members at this point in time that are thinking about, adopting these patient engagement strategies, either with technology or otherwise? I know you've really, really emphasized the change management aspect of things and engaging your team. What other pearls do you have for us?
Yeah, just try it. The worst thing that happens is you try something, it doesn't work, and you go back to what you did before, and that's fine, right? But just have that openness to try, and if it doesn't work, reflect on why, because perhaps it wasn't the right technology or the right solution that you needed for that moment, because you actually didn't look at you weren't solving the true problem. It was a cool bell and whistle, but it actually wasn't solving your underlying problem. And so that root cause analysis of what you're trying to do and what you're trying to solve for, that first step is the most important step. And then finding the technology that can solve the problem that you're looking for is the next step. And sometimes we do that backwards, right? We find something very cool and we try to put it in, and it doesn't work because it didn't solve an actual problem. It was just something very cool.
Yeah, I see that happen a lot, a technology finding a potential problem. And I think it's got to be the reverse for sure. And Megan, on from your perspective, what are some pearls that you can give us and our audience members for when they're trying initially to figure out what they're going to do with patient engagement and how they're going to adopt technology?
Yeah, I think definitely Dr. Panich hit it on the head. I think that's the most important one is, even if you try it and it doesn't work, you can always go back. So kind of, it's not like a lifetime contract, or hopefully you're not signing a lifetime contract, but don't sign any lifetime contracts. But I think too, and this was something that was mentioned earlier as well, but I think engaging the folks that are going to be using the tools day to day, having their buy-in, getting their input, helping them feel a bit of ownership in that change management process, and then celebrating those wins as things start to work. I think those are, just really key pieces of the process that when we see things work really well, those ingredients are there.
Fantastic. Well, I appreciate all of your perspective on patient engagement and using technology to enhance patient engagement. I also want to thank our listeners today for joining in. And so everybody have a great rest of your day.
Thank you for the opportunity to share.
Thank you.
Thank you to all our speakers today. I just wanted to remind everyone that if you have other questions, you can use the discussion board on the right-hand side of your screen to post them, and we'll get answers to them from our wonderful subject matter experts here. And if you'd like to check out additional tools and resources, I'd encourage you to check out the Steps Forward website. Thank you, everyone. Have a great day.